ground transport is what actually ends up adding up for most employers, because it's such a high frequency event versus the air. Did you get a crazy bill after that, or what was it covered?
Well,
do you remember?
so that was the other side of it, right? So after the accident was over, you cannot believe the box of paperwork.
Oh yeah.
You know, the many bills and EOBs, and now you've got, you know, claims that are being subrogated. I mean, things that no patient should have to be dealing with as they're trying just to get back to normal health.
Yep.
And again, a lot of these were the motivators for creating SimplePay Health.
Yeah.
You know, let's get the patient the best quality care, and let's get rid of the insurance complexity.
Well, I can't tell you how many times it seems like there is an event like that, a catastrophic event that ends up triggering somebody's business pursuits.
It's kind of, you know, it's kind of one of those things where I don't believe in coincidences.
Yeah, we don't want to knock on wood, like, hope I get hit by a car and come up with a
No.
business idea. But I've had probably a dozen entrepreneurs on this show, just happen to be in the healthcare industry, and almost everybody has some sort of catalyst event.
There's some kind, you know, because you know what, the stuff we're doing is not easy. It's hard, and part of what keeps you pushing through the difficult times is when you realize the good that it can do for many people, and that's kind of what we'll talk about.
When you solve your own problem first, right? I mean, there's a pretty consistent through line that the entrepreneurs find out they have a problem in their own lives and realize there's an application at scale for this problem to be fixed.
That's right.
So I'm very excited about this. And I've had Matt Brost on, I've had Mike Cole on, guys that I know used to be a part of the organization, and even after they left, could not say enough good things about SimplePay, which is that's a testament, right? They're not able to work there anymore, and they still talk about how great the product was.
And they're both great.
Yeah, and they landed on their feet. They're both in good positions now too.
Absolutely.
So I've been very anxious to dig into this for a while. So I'm glad we get to do that. Anything else?
No, I mean, just let's kind of go in any direction you want, and we'll just see where it ends up.
Happens. Yeah. Well, I will tell you this. Almost, I don't know if I've ever had anybody say that it didn't end up better than they expected when they actually got to see it. Some people don't like to see themselves speak, or they don't like the sound of their voice.
Yeah.
But if you're comfortable with that and you actually get to see the quality of the product afterwards, almost everybody is
I've been through so many of these that, because I remember the first time I'm like, oh dude, I don't like, I mean, I do enough of them now where I kind of know my voice isn't what I hear in my head.
Yeah, that is an interesting phenomenon. You hear your voice for your entire life, then you hear it externally recorded and go, "That's what."
These are easier to do than the videos. You know, like I don't work well off a teleprompter. Yeah. I actually enjoy just more of the conversational videos,
I'm the same way.
And because they're not scripted, they're just off the cuff, and they're natural.
Well, it's natural, but this is the conversations we have on a daily basis on sales calls and broker offices.
Yeah.
It's almost like you're capturing two people talking through a sales call, but you get to be a fly on the wall to hear that sales call. But also there's the rapport building, the relationship building element too. And that's what an hour-long conversation gets you that a webinar doesn't really get you, that a quick snapshot about a product doesn't get you.
That's right.
It personifies the solution a little bit more. And I like the story. I really like the story element. I know you're gonna have some stories.
We'll tell a few analogies, because I think those are the things that are often a lot more not maybe as memorable.
Yeah, they'll remember.
There's the memorable analogies and stories that people people kind of connect to.
I presume we're good to go. As soon as Nathan sits in that chair, that's when I know we're all
right.
We've probably been rolling for a minute, and the reason we do that, just so you know, is I don't want this really like cold, and we're waiting to say the first line. So we'll go ahead and get it kicked off. So Wally Gomaa, co-founder of SimplePay, how are you, sir?
Doing better than I deserve.
Better than you deserve. That's our Dave Ramsey.
Oh yeah, I'm a big Dave Ramsey follower. I'm a big follower.
I love that. I love when people come up with their phrases, But you have an interesting nickname. You have Captain Passion, which you shared with me. I'd love to at least tell the story of the origins of that nickname before we dive into the podcast fully.
Yeah, well, I've been blessed and fortunate to have been a part of a lot of startup organizations, and I always believe play to your strengths. And as the chief storyteller and the evangelist about the good news of things that we were doing, I became kind of called Captain Passion, the guy that's going to go share what we're doing to the industry with passion. And
you went insofar as actually putting it on business cards.
We had it on business cards. So some of my business partners, a guy named Dem Bishop, is president of Holmes Murphy, one of my dearest friends and business partners. He was the chief maker-upper.
Okay.
Our chief operating officer. She was the chief cleaner-upper.
Chief cleaner-upper.
And then there was me, Captain Passion. We had another gentleman on our team, Brad Bierman, but we could never really come up with a creative name for him. But he just
had a normal title.
He was the technology, wizard. So,
okay.
Yeah.
Well, I'm sure that's fun to actually, when you sit down with a new prospect or somebody and they read your business card and says Captain Passion, it's a nice icebreaker, right?
Yeah, you got to explain what Passion's about.
Yeah.
Otherwise, people are like, "What are you doing?"
Whoa, you sit over on the other side of the table, please.
That's right. You don't want to creep anybody out.
Yeah. So Captain Passion, but I'll refer to you obviously as Wally for this episode. But the purpose of today, right? I've been dying to talk about SimplePay. I was just sharing with you off camera that a couple gentlemen that have been on this podcast that were with SimplePay for a period of time and no longer there, even after leaving, were espousing the virtues of what SimplePay is doing for the market. And I'm going, okay, I got to dig into this and actually learn about it. And I've seen it come up in passing, but really hadn't had a chance to sink my teeth into what you guys do. And so that's going to be the gist of today.
Awesome.
But one of the best things I've discovered to kind of get to know somebody is hear some of your story, right?
Yeah.
The motivators of why you do what you do, how you got in the industry, things like that. So Wally, give me some of your backstory, and then there's a couple really key experiences I want to ask you about after that.
Yeah, well, I mean, I will tell you first from a professional experience in the motivators. I started my career in the Houston Medical Center working for a provider system as a financial controller. Defected to the other side of the fence, worked as president for one of the national medical insurance carriers. Worked as an employee benefit consultant before, really finding my stride over the last 15 years and starting up new companies in the healthcare space to try to change the world. And, I think it's those experiences, having been in lots of corners of the industry, where you realize everyone's trying their best to do a good job to make a difference. We often work against each other, in terms of, what area of the healthcare industry we're in. But it's those sort of broad professional experiences that help me, sort of look at the big picture to say, what could we do, to create better healthcare for patients and, a better and simpler insurance model for members.
Well, you've seen it. So you just hearing your background. So you've been on the provider side, you're on the carrier side, you're on the broker side, and then you got obviously the more innovation and tech and building health plans and things like that. So that's a pretty diverse vantage point to be able to build from. How long were you a consultant though? How long were you performing that role?
I started with Holmes Murphy in 2003, and that's really where I came into employee benefit consulting out of an insurance company. And I still think about, that transition. I left a big insurance company, had 1,500 employees that reported to me in the organization that I led. And I thought, I'm going to show these brokers how insurance is really done. And I think I was a month in, and I actually called my wife on the way home when, on the drive about a month in at Holmes Murphy, and I said, I've made a horrible mistake. I'm like in way over my head. Like I don't know anything really about, how the system really works. And, again, just, thanks to Dem Bishop, who took me under his wing and taught me a lot of what I learned.
Well, that transition from carrier to consulting seems to be, I went the opposite direction. I started on the broker side and went to the carrier side, but it seems like a pretty natural transition to spend time selling products to brokers, but then obviously they have a pretty good basis of knowledge for how these insurance products work, how to sell them, how to understand the differentiators in the market. And I think that gives you a pretty good training ground to go in and then invert that process and start representing an employer.
It was a transition moving from selling a product to actually now you're becoming somebody's advisor, somebody's trusted advisor. And, I'm grateful, that I had the transition. There was a lot of patience and tolerance for me to make that transition, by the people I worked with. But it was moving from selling a product and being a product specialist to being an advisor. And I think fortunately I get to sort of draw from both of those types of skill sets, which are a little bit different, from each other, and that I use today, and what we do. We consultatively sell products, because we're back in the product space, but we're doing it in a consultative way that really focuses on what's best for the buyer.
Well, and you've had a couple catalysts. I mentioned or alluded to some stories that I think show a profound reason why you do what you do. And so I'll leave it up to you which one you want to do first. But the two key stories that I know of, obviously you had a cycling accident, and then also you've lost a significant amount of weight about 20 years ago. So whichever order chronologically you want to dig into, but I know those are both pivotal moments for you.
I'll do them in chronological order.
Okay.
So, after joining, Holmes Murphy on the broker side, I actually made a transition into co-founding ACAP Health. It was a wholly owned subsidiary where we were developing and distributing different products. And one of those products was a program called Naturally Slim.
Okay.
Became one of the country's largest pre-diabetes and metabolic syndrome programs. Really, we worked with millions of lives around the country, clients like Google, big state governments, universities, many of the largest hospital systems. And it was really one of the first programs in the country in that space to be covered by the major insurance carriers as a preventive medical claim. And we made a difference in the lives of millions of people, reversing their clinical risk factors and helping them, I say, as a byproduct to lose weight. And I don't believe in coincidences. Before, really, stepping into that role several years before that, I had actually lost about 140 pounds. In full disclosure, I used to be 6'8". I'm 5'7".
Yeah, okay, that's part of the loss, right?
No,
me too. Yeah,
that's it. But you look at it and say, was it those experiences in realizing how people struggle with their weight? They feel like they're failures on diets. What we learned was no. Diets have failed them, and the things that we were bringing forward, were really life-changing, again, really for millions of lives.
Well, can I dig into that a little further?
Yeah.
What was some of the methodology behind Naturally Slim, like how you did that?
We kind of call it the Fosbury flop of nutrition.
You mentioned this last week, and I knew what it was, but I think for the audience's perspective, the Fosbury flop. Let's talk about where that came from.
I think everybody should Google it, right?
Yeah.
It's a great true story of Dick Fosbury, 1968 Olympics. In Mexico City. So he was a high jumper. And, before Dick Fosbury, everybody went over the high jump stomach first. And he shows up at the Olympics and he gets to the bar, rotates and goes over, with the bar under his back. And so no one had done it that way before.
Yeah.
And, he was criticized. What are you doing? What science later came back and proved is that it's just geometry, is science, that you can actually clear a higher bar if right as you approach it, you rotate and let the bar go under your back versus going stomach first. So we used to say Naturally Slim was the Fosbury flop of nutrition. Before that point, the focus was on what you eat. Eat this, don't eat that. What we realized is, no. It's not what you eat. It's how you eat and when you eat. There's a reason why some people are always naturally slim, even though they sit across the table from us and eat whatever they want to eat. We say, hey, God loves those people more. But what we now understand is that there's a scientific reason on how and when they eat their food. And Naturally Slim, which is now branded Wonder, so we've had a successful exit of that business. That business was sold, was one of the ACAP products that was a real core of that business.
That's amazing.
But now it's out and I like to say it's sort of been sold and gone to college, right?
Gone to college. It's off to college now. All grown up.
And doing amazing things.
That's really cool. Preston Comical mentioned that on the podcast probably about 6 months ago, and I admit I hadn't heard of it, but it sounds like
he was the
one
that actually introduced us to Marcia Upson, who was the family nurse practitioner, and was really her and her mom, that were seeing these observations in the real world. And then we brought it into the insurance industry and kind of gave it legs. But Preston's the one who gets credit for getting us connected with Marcia. Otherwise, the great things we did would have never happened.
Well, and it's funny, you said you use it for yourself. It's kind of like the hair club for men, that you're also a client, right? Or so, those old infamous commercials. But do you think that helped you in your ability to sort of articulate the value because you experienced it yourself?
Spencer, I would go to meetings and I would talk about these things of what we know. And I think sometimes people would look at it and go, well, what does this guy know about, what it means to struggle with weight? But then when I would share my personal story, then it sort of de-armed and go, talk to me more about this. And, weight loss is super personal, for, the 80% of adult Americans that struggle with their weight, they think about losing weight every day. And we wanted to give them hope that there is a better way. And I'll tell you, I've never seen anything that as a business person, we were doing to affect, the quantity and quality of people's lives just as much as we were
that's what
doing.
I've been talking about this quite a bit. And, I talk pretty regularly about being an advocate of intermittent fasting and how that's going to sort of help me control my weight.
That's when you eat, right?
That's when you eat,
when you're catabolic, not your anabolic, right? You let your cells deplete the glucose from your prior meal. We didn't know what intermittent fasting was when we were doing it.
Probably wasn't
but now it's a widely understood and recognized area of nutrition sciences.
Well, what I respect though is I was lamenting and have been lamenting about how do you apply these methodologies in a group setting, right? How do you do this at an employer scale rather than just get to one individual that makes a change in their one life? Is there a way that you could be doing this on a group basis
Well,
instead?
so
like
we were
figured that
fortunate.
out.
We started with the train the trainer, let's get people in a classroom, but you quickly run out of operational scale. We were, one of the things, because you think about all the things we were doing here, we were also bringing forward for the first time digital therapeutics on a broad scale, like pre-YouTube, right? These were things that we were bringing forward. Roughly? We started the business and the mission, I like to say, in 2007, but things really started to accelerate in 2010. It's 12 years ago, right? But 12 years ago was an eternity. It wasn't like we were all having smartphones in our pockets the way we do today. But being able to do things on a digital level, on a broad scale, with curriculum that's grounded in good science, it's pretty special. You can really reverse your clinical risk factors in a very brief period of time without medication if we can naturally teach individuals how to let the metabolic engine work the way that it was supposed to.
That's amazing. And I love that. I want to keep going
we
on
could
there.
We could spend our whole time there.
But the other story, right? I want to hear the story about the cycling accident because I think that's probably a more direct connection point between what you're doing here and SimplePay.
That really affects more the SimplePay. So, after being in the healthcare industry for a lot of years on different sides, I had the experience of getting hit by a car riding my bike. I used to pretend I was Lance Armstrong on the weekends without the performance enhancing drugs.
Okay, fair enough. Full disclosure.
You can do a blood test, but I got hit by a car. Lady texting and driving. You can imagine the story. And I got scooped up off the road. Rushed to the nearest hospital. And, laying there in a mess. I mean, I was a mess.
What were the extent of your injuries?
My left arm, I will not describe it for those listeners that might not have a strong stomach, but it was a left arm injury and it was a mess. So I'm laying there, they stabilized me, and the surgeon who is attending to me at the ER, they called him in as an orthopedic surgeon and a trauma surgeon, came to me and said, listen, I can't fix you. He goes, the extent of your injuries are so severe, there's really only one surgeon in town that can fix you, but I'm running into some business friction because that surgeon practices medicine at a competing hospital.
So this is happening while you're laying in the ER. You said stabilized, but I mean, you're in limbo at the moment.
I'm in limbo. They're trying to figure out whether they're going to helicopter me to this hospital or that hospital because they clearly can't, treat me at the hospital that I was in. And thank God that I knew enough about the healthcare system to say to the doctor, listen, I am telling you as the patient, I want to be transferred to the doctor that you feel like is going to be able to perform the surgery the best. And they ended up, so you had two hospitals basically competing for who's going to keep the patient, right? There is the decision on what's best for the patient clinically, or is it about the money?
Well, that's not the type of competition we really want to facilitate in this industry. But thank God for the doctor that knew the person to refer you to, and even felt, obviously felt compelled to tell you. I mean, if it's at that extent where it's like, I cannot do this, but I know somebody that does it, there is no business decision, in my opinion, at that point. It's get him to the person that can fix it.
We have to be transparent to say that a lot of decisions that happen in the healthcare industry, and I say healthcare industry, I'm including everything from employer-sponsored plans to to providers that are delivering care. A lot of it is motivated, as we know, by money. I think a book that I would commend to all the listeners today is a book by Dr. Marty Macri called The Price We Pay. I was fortunate to have dinner with him several weeks ago, and I tell you, it's a gift to the industry. I think everyone in our industry should read it, and it reveals how money can influence decision making across the board, and we need to be better. We need to be better.
I would agree 100%. So you got transferred, and by the way, Dr. Marty Macri, if he hears this, I would love to have you on. Been one of my bucket list guys to have on. But so you got transferred to the hospital. They were able to fix your arm. You said you've got maybe 80% use of it now.
I didn't think, and I don't think the doctors and Dr. Casey Cates, who was my surgeon, I don't think he thought it would have as much function as it does today. Wow. So I don't even really think about it anymore, except for the experience at getting bounced around as a patient, and then what happens afterwards. Imagine the boxes and boxes of paperwork. The bills and the EOBs and subrogation. Like, it is we've made such a complex system, and I could never figure out who I need to pay what to. And I mean, it was all of that experience and much more, that led me to kind of think back of, if we were going to start from the beginning to create a new model of insurance, what would it look like?
And so when was the actual genesis of what is now SimplePay? How long ago was
so
that?
one of my co-founder in SimplePay is a gentleman named Scott Shainvogel.
Okay.
Scott was the CEO and founder of Compass, which has been sold to Alight. So he had a successful exit in that business to Alight. But Compass, one of the largest patient navigation, price transparency businesses. He and I started, putting our heads together back in 2017, and then in 2018 we kind of, formally said let's do this, to start designing a new model of insurance. Since then, we've been fortunate to have added Dr. Eric Bricker to our team.
Know him very well.
Really highly regarded. I think he's the most well known of the three of us. And,
well, he's got the whiteboard reach that I want to be when I grow up.
His Hey Healthcare Z.
Yep.
In a lot of ways, we got the band back together again, and
that's great.
Between Scott, who is one of the gurus in the industry, he was actually the chief revenue cycle officer for Baylor Scott and White Health System, and really a consultant to many of the largest hospital systems in the country before coming to Compass. He and I kind of decided, what would a new insurance model look like if we were starting from the beginning.
So when did you know, when you had those early conversations up until you thought it was something you could take to market? Was there a moment in time where you really figured out that you were onto something, or was it a slow and gradual effort? With a lot of things, right? You try this, it doesn't work. You try that, it doesn't work. What we started to realize is that when we got rid of insurance complexity, patients started behaving like consumers do in the real world. And we got to separate patients from consumers, because it's not like we're buying a TV. Healthcare, I think, is more personal, more important. I'm biased on when I say that. Yeah, but we spend more time researching the TVs than
we spend more time. Well, we have more information at our fingertips.
And it's easier to get.
It's easier. Yeah. It shouldn't be. It should be easier to make good decisions in healthcare. And so anyway, I think as we started experimenting with different plan designs and payment models, and all of that really came to to creating the model that we use today. And we've continued to adjust and perfect. And I can talk a little bit about the results we have, but I'll tell you, grounded in all of this is not just to simplify healthcare for the sake of simplification. The health insurance industry ranks dead last in a study that's called the Global Brand Simplicity Index. It ranks every industry from simplest to the most complicated. Health insurance is always ranked dead last as the most complicated industry that a consumer would interact with. And we wanted to not only simplify to create a better experience, but to get individuals to be naturally self-motivated to select higher quality care from the providers in their community.
Well, is the complexity element the main element you were solving for? Is it payment and complexity? I mean, tell me the actual pillars of things that you were tackling head on.
If you think about what makes health insurance so complicated, it's obvious, right? There's these confusing plan design terms: deductible, coinsurance, copay, out-of-pocket maximum. Only 4% of plan participants, if you give them those terms and ask them to match it to the definition, can match all 4 terms to the definition.
Oh, really?
Only 4%.
Wow.
So we go to these open enrollment meetings, we keep talking about, these things, but individuals just nod their head. They don't really know how coinsurance works. They call it coin insurance. They think it has something to do with money. They don't really know. So we said, listen, you don't have to have coinsurance and deductibles to buy a TV. Could you actually create an insurance model that gets rid of all that plan design complexity and gives every covered medical and pharmacy service a price tag? You know the price of everything to you as the patient before you go. Our whole thesis is you can't be a consumer of anything unless you know the price of everything ahead of time.
Yeah, I mean, that's just it. And I watched one of y'all's YouTube videos, which is actually really well done. Funny, it was the juxtaposition of the SimplePay plan versus a traditional plan, and that, the humorous guy standing there like, don't you understand embedded versus aggregate? And I thought it's funny, but it's funny because it's true, right?
True.
Because nobody really understands that. You said 4% of the people can actually successfully identify those terms. I'm in the industry. I still have difficulty kind of coming up with, well, what am I going to pay if I have to go to this particular facility or something like that? You don't know.
We all do, right?
Yeah.
And one of my friends is a CEO of a large hospital system, and he used to tell me, say, Wally, when the bills and EOBs for care that's being delivered to my family within our own system, I would wait 3 or 4 or 5 months and tell my family, don't pay anything because we don't know who we're going to owe what to.
Yep.
And even after the bills and EOBs come in, we still don't know. We spend a lot of energy in our industry, as you know, talking about surprise bills in healthcare. Usually that's linked to out-of-network care. My opinion is every bill that you get's a surprise bill.
Oh,
you
it's
never
absolutely.
really know what
Well, my
something's gonna
favorite thing
cost.
is you go in and they say, okay, we're going to run your insurance and here's what you owe. And then you go, well, what is actually being billed? Like, how much
right.
is it going to cost? Oh,
That's
we're
right.
not quite sure yet. We'll send you a bill later.
That's
But we
right.
know what you have to pay today in order to receive this care. It's pretty, it's not even nonsense. It's perverse in my opinion. Yeah,
It is.
So you're seeking to simplify that process. So why don't we take this moment? Let's actually describe SimplePay in a
Let's
little
do
more
that.
detail, what the solution is, how it works, and then I'll do some follow-up after that.
So think about how you buy anything else in life. You might know the price. You might do some research on, what's the quality. And that's step one for us, right? We give the patient 2 pieces of information they should have had years ago around quality and around price.
Okay.
On the quality side, I like to say we're not reinventing the wheel. Nobody has to go to open enrollment to know that 5 stars is better than 3 stars,
Yep,
right?
it's
We
pretty
know
simple.
that. Give them credible information that's easy to understand. Don't have to go to medical school to be able to know this doctor is higher quality than this doctor. So that's step one.
Okay.
And combine that by giving them a fixed price out of pocket for every covered medical and pharmacy service.
Okay.
Where price tags will be lower for higher quality care, as they should be.
Should be, yep.
Higher quality care generates more efficient delivery of medicine, fewer complications, readmissions, infection rates, never events, never leave a surgical instrument in a patient. It's a real thing.
Okay.
So we set lower price tags if you go to higher quality providers, and those price tags, and this is key, those price tags are fixed and all inclusive.
Okay.
So let's say Wally was having, his hospital stay for his bicycling accident.
Okay.
Instead of deductibles and co-insurance and not really knowing who you're going to owe what to, you would know that your hospital stay has one price tag behind it, and it covers everything that happens from when you're admitted until you're discharged.
Okay.
One price, where that price again is lower around quality.
Well, in that instance, that's more of an emergent condition, right? Where you don't really have a lot of choice of where you go. But
That's
talk to
right.
me about something that's a non-emergent example
Yeah.
of the same thing. So I get to pick between this facility and this facility, or this doctor and this doctor.
That's right.
Maybe the range of pay and how you do that quality scoring.
So let's say you're going to go to an ologist,
Okay.
Cardiologist, oncologist, neurologist. In our model, you can go to any provider you want in the country. We have partnered with Aetna and Meritain, their TPA, business, to make this available on a national level. And we tell everyone, we're not narrowing networks. We're the TripAdvisor of healthcare.
Okay.
Go wherever you want to go.
Yep.
But we're going to empower you with this 2 pieces of information you should have had before around quality, around price. So you're searching for an ologist. You can go to any cardiologist you want, but if you go to a provider that we've ranked as being top quality, your price, your SimplePay amount, technically it's just a copay,
Yep.
is going to be lower than if you go somewhere else.
Okay.
What's really important here is, in our model, we've learned that healthcare is a team sport. You cannot be a top quality specialist if you don't have admitting privileges to a top quality hospital service line.
Okay.
So if we can just get the patient to make one good decision of the doctor they're going to go to, that generally leads to top quality throughout their episode of care.
Interesting. Okay.
Yeah.
So what is the range of that potential copay? we talking 10,
Sure.
$15, or how far does
so,
that range
so our
go?
plan designs are ACA compliant, right?
Okay.
So we're going to have, gold, silver,
Okay.
level plans generally in terms of value. So an office visit copay for a specialist might be $25 for a top quality. Could be lower if it's going to be a richer medical plan. Could be $10 or $15. Maybe you go to a provider that we would rank as being average. Yellow, we use colors, green,
Okay.
yellow, red. That might be $40. And if you go to a provider that we would say maybe not your best choice, that might be a $60, $70 charge. So that's for your office visit,
Yeah.
all inclusive.
All inclusive.
All
Okay.
inclusive, right? Covers everything that happens from when you walk in the door, you walk out the door, even if they did it in an office lab test or an EKG. The point of this is patients need to have not price transparency. They don't really, when we did testing on this, patients don't want to know the contracted rate between the insurance network and the provider. They don't really care. All we care about as human beings is what does it cost me?
Yep.
And so by giving the patient price certainty, a fixed price where they know they're out of pocket ahead of time for every covered service, it becomes very motivating for them to go to higher quality providers, which also they can see transparently will cost them less with certainty.
I like the price certainty, that terminology. That makes a lot of sense to me. And even then, right, you still guide them through the choice, steps of that choice, and ultimately it is still their decision, right? There's not enforcement. There's just incentivization through a lower cost, right?
That's right.
The presumption, though, is that even that delta of $25 or $50 might be enough of an incentive to get them to choose a higher quality provider.
That's right.
I think also knowing if I'm a patient, right, if I go, oh, well, it's going to cost me less and that person is a higher quality provider, like why wouldn't I drive an extra mile maybe,
That's
or
right.
whatever that calculation may be in my head. I think tying those two things together as a consumer of healthcare makes a lot of sense because it's not just the dollars. I actually want high quality care at the same time.
That's right. There's another Fosbury flop thing in this,
I want to hear the
model
other,
as well.
Yeah.
The narrow networks, high performing network models, we actually think that we should have been doing the opposite of those now that we understand what's going on. Every hospital system, as an example, has some clinical service lines they're great at, some they're okay at, some not so much. Okay. So we really need to have patients that are going to the hospitals that have the best clinical, one hospital may be best in town at cardiology, but not the place to go for orthopedics. Okay. And we need to combine it with the best physicians who have admitting privileges at those hospitals and measuring physician performance, not the way our industry has historically done it at the tax ID level, where 10 doctors may operate, or practice in one practice together under one tax ID. We need to measure the individual doctors at that individual NPI level that we call this. Matching and using, behind the scene technology to match best providers. Healthcare as a team sport, has been proven to deliver the best results.
Well, so let's drill this down into kind of an employer profile, like the fit, right? Because I think I often will hear solutions on the podcast, and then I'm trying to necessarily drill in, all right, the theoretical sounds amazing. Like, let's talk about the practical. So who would benefit from this? And
well, there's another part to the SimplePay model
please,
that helps to kind of, confirm, is an employer a good fit for this or not? And it was a big learning for us that telling a patient, here's your price, you have price certainty, did not create simplification when all those bills and EOBs came in the door. Because they could never figure out who to pay what to. So we had to get rid of all that. And probably one of the most transformative things we're doing to really kind of change the way our industry works is that we've eliminated bills from providers and EOBs in this model and replaced it with a single monthly statement. So how do we do that, right? So patient, has care from a provider submits their claim to Aetna Meritain, the network discount is applied. What Aetna is doing is paying those providers the contracted rate in full. And not reducing the provider's reimbursement for the patient responsibility. Which if you think about it, it's like how every other industry works. If I go to a retailer and I buy something with my credit card, the retailer is paid in full by the credit card company, and 30 days later, you get a monthly statement from your bank. Now, when you show your Aetna Meritain ID card, providers are paid in full, always, and then the patient gets one monthly statement from their health plan, and the amount will match. And it's that combination of price certainty, quality transparency, and then you get a monthly statement that shows, hey, you actually owe what we showed you were going to owe. That creates the engagement rates that really went through the roof.
So is that the copay element then, or is that
It is.
So you're not even paying the copay up front either. Oh,
you go to the doctor's office, show your ID card, you leave, because providers are paid in full. You go to the pharmacy, you pick up your drug. You go to the pharmacy, you pick up your medication, you show your ID card. Providers are always going to be paid in full. It's kind of crazy that we don't do that the way every other industry does. It's almost like if I went to a retailer to buy a television and they don't collect some of it from me and some of it from American Express. No, they're paid in full, and then your bank settles up with you 30 days later. That's what we're doing here. Pay providers in full, let them focus on practicing high quality care, and then let's send from the health plan a single monthly statement where the price on that statement will match the price that they knew they were going to be responsible for.
Simple.
One more thing.
Simple.
One more. I'm going to go one more place.
Okay.
And this is a big part of our motivation in us trying to change the world, is the recognition that for many American families, they don't have over $500 laying around to pay the out-of-pocket cost of an unexpected healthcare event. On a good day, Spencer, we're using high interest rate credit cards and taking out payday loans to pay that out-of-pocket cost. On a bad day, about 25% of Americans avoid medically needed health care because they're making choices between, do I pay my mortgage this month or do I have health care that's needed for my family? So in this model, we've added a really cool financial well-being benefit. When your monthly statement comes in, you can pay the balance in full, or you can pay the minimum amount due, and you can revolve that balance with a 0% line of credit that's available for all health plan participants.
Are you embedding something like a patient or something into that model?
We are.
So
Okay,
cool.
Our behind-the-scenes partner is Patient, spelled P-A-Y-T-I-E-N-T.
We know them well, and I was actually, that was a lucky guess. I did not know that in advance.
They are our business partner that basically is providing the float, right?
Yeah.
Pay the provider in full and then collect and settle up with the patient a month later. But it's all embedded in one seamless experience, right? Show your ID card, you get one monthly statement from your health plan. All these behind-the-scenes business partners like Patient are really what helps us to make all this possible.
Well, that's amazing. And actually, before we go to the employer route, I have some follow-ups because I want to point out what you've essentially done is completely sort of dispelled the notion of high deductible health plans being these consumer-driven healthcare arrangements being the ideal way to get people to consume healthcare. This notion that if we offload a lot of the cost onto the employee, that they'll somehow make better buying decisions. But I think what actually happens is what you just alluded to, is that, no, I'm delaying care. I'm not getting the care I need. I'm waiting until this develops into a chronic disease, and now I have to go to the hospital, even though I still can't afford it. But you've given me this impediment, this layer of cost that I'm now responsible for, that is far and above what the average American is able to actually absorb anyways.
That's right.
So this is basically stopping that and flipping the switch completely on that model.
And listen, we can run this model as a high deductible qualified model, but to your point, and I completely agree, and there are countless studies over the last few years to show that just putting somebody into a high deductible plan and giving them more out-of-pocket financial responsibility does not necessarily bend the trend curve or create better health. Having more financial responsibility out of pocket without the tools to know which providers are the best and the support with a concierge to help you navigate to the top quality providers, that's what ends up producing a better result. And I think the overused word by our industry of consumerism is we tried to bring forward these consumer-based plans, but we didn't have a model that actually worked the way it does when you buy anything else in the real world. I will admit, when we designed SimplePay, we really didn't invent anything. We just made health insurance work like any other consumer purchase. You know the price, you know the quality, you get one monthly statement.
Well, that begs the question,
really that simple.
Why did it take so long if it's such a simple idea?
I'm really grateful to, organizations like Aetna Maritime that looked at this and said, do we think of this as a disruption to our model, or do we actually partner to try to transform the healthcare system? And I'll just tell you, a lot of the things we're doing behind the scenes around the plan design that aggregates for all covered medical and pharmacy services, a actuarial plan design and a copay that covers everything that happens door to door. Like, there were years of work and development to build that adjudication engine. I know it sounds simple. Pay providers in full and then send a monthly statement to the patient and give them 0% financing line of credit. Like, all those things sound really simple, but I mean, this took us years to develop the technology, the integration, to aggregate business partners, to be able to hopefully see, our vision.
Well, and I'm sure just industry forces, right, are up against it. So some headwinds, right, that you have to deal
and
with.
Listen, so in addition to just the fact that this is like crazy hard to put together, is still an industry, that represents about 25% of the economy. If you look at healthcare, right? There are still institutions that would rather, play the game of status quo, because status quo pays really well.
Absolutely.
And we ran into some of those headwinds. We actually started as a disruptor, and we realized that, what we really should be is an enabler. Find organizations that want to work together, to try to solve the industry's problems, and stop playing this game of industry musical chairs to try to knock each other out of the way to get a seat at the table. And instead, we're on a sofa here. And instead, let's all get on a sofa working together, to try to solve the problems of our industry. I think a lot of, in our old days when I was on the consulting advisor side, we used to ask employers, who do you think is the enemy in healthcare? They'd sometimes say, well, it's the pharmaceutical companies, things are too expensive, or they might blame hospitals, they might blame insurance companies. And we say, no, the real enemy in healthcare is disease, and we need to all work together to try to, use insurance to improve the quantity and quality of people's lives. And that's kind of what we're doing here.
Well, I love it, right? And I think it is, at the end of the day, we are rallying around trying to prevent disease, right? Or trying to manage disease better. I mean, that's why, again, I come up against fasting all the time, or personal sort of accountability and exercise and taking care of yourself. Because that's, you want to talk about how we could do that at scale, is just get people's behaviors to change.
No question.
Well before they ever have to go into a hospital.
Or if when they need care, don't walk, I've kind of not really spent a lot of time on our new understandings of quality, and these are areas that Scott Shane-Vogel, Dr. Bricker, bring, sort of national expertise in. But I will tell you, the differences in provider quality is a massive gap, and I think we're just on the start of bringing quality transparency to the industry.
Okay.
The way I've had Scott, describe it to me, which resonates, is it's just like when we were back in school. You had some students that were the top of their class, most in the bell curve, and a few from how did they make it from the last grade? And medicine is no different. And we have to get honest about differences in quality, get honest about how money motivates sometimes bad decision-making in medicine.
Sure.
Again, read the book by Dr. Marty Macri, The Price We Pay, and I think those realizations have sort of been captured into the model that we bring forward with SimplePay.
Well, let's take it down to that employer level we were going to get to earlier. No. I'm glad you stopped me before it was time to go that route. But I do want to actually talk about a real world application, because then this is when that conceptual turns into the applicable, right?
That's right. That's
so,
right.
What type of employer is typically an immediate fit for this?
So we get this, we hear a lot from, we obviously are introducing this usually to brokers and consultants around the country, and then we get in front of the employer, with their support, and we hear the question of, this sounds too good to be true. You kind of said it a few minutes ago. Why haven't we done this before?
Yeah.
And I'm like, hey, tap the brakes. There's some things we're doing that we want to make sure culturally aligns to determine whether this will be a good fit for your organization. And they cover the two things we've touched on. One is ranking provider quality. We're not narrowing the networks, kind of go wherever you want to go, but you now have this information to decide what you want to do, realizing that there will be lower price tags to the patient if they go to higher quality providers. Some providers culturally need to check themselves and say, are we ready for that? Because they will have employees walking into their office saying, it's not fair that my doctor is ranked red. I've been going to them for 20 years, and now I'm being charged more. I always want to remind employers, we're not charging the patient more. We're just giving them finally the understanding of how this provider performs and practices medicine actually ends up costing more. You just don't see it ahead of time. We did have an employer we were presenting to, a large, well-known national employer, and the chief human resource officer said, I don't think it's right that our employees would be penalized because they went to a provider that we've ranked red. It's not their fault. And I looked at that in my mind and I said, not a good fit. So that's number one. Number two is the monthly statement that we send has tremendous benefits. No more bills or EOBs. One simple monthly statement, 0% line of credit. There's a lot going on there that's really important, but at the end of the month, you have to pay at least the minimum amount. If you don't, we're gonna try to collect from the patient. So the days of getting your bills and EOBs and shoving them in a drawer for 3 or 4 months, like you can't do that in this model. As long as an employer can think through those and the benefits we're bringing, and they can get not just comfortable with it, but excited about what we're doing.
But there's not co-insurance again, right? So there's not. So we're not talking. Ideally, we're not talking about a very large amount of bill on a monthly statement.
No, I mean, but you listen, we're still running, out of pocket, responsibility that might be in that actuarial level of an 80-20 plan, maybe a silver plan. So you're just paying it through individual copays until you hit your out of pocket maximum. So we're just collecting it through copays. And, a hospital copay is not going to be, $10, right? So some of these copays are almost like mini deductibles. So patients are still paying their out of pocket, but the difference between going to a hospital, using North Texas example, since that's where we're filming today, going to a hospital that is top quality for a clinical service line from one that maybe not so much, it can be an over 60% reduction in the overall spend. So your copays going to a top performing hospital is going to be much lower than if you went to a hospital that, we would rank as red.
And at the end of the day, this still has to be competitive, right? So this is still going to be price competitive versus what they might traditionally get in a fully insured plan or a self-funded plan. So how do you kind of underwrite this in a way that still keeps it competitive in the market?
I'll tell you, the biggest thing for us as it relates to SimplePay is results.
Okay.
If we're not delivering measurable results, why would you do this? In fact, I'll go back and say in the days of Naturally Slim, we used to tell employers implement this model. And if we don't return clinical lab values back to normal for this percentage of the group, then we will put our fees at risk.
Okay.
With SimplePay, if we don't get individuals to shift towards top quality, we provide performance guarantees. Now, we've never missed on it, right? Human beings are very predictable. Go to open enrollment, explain to individuals that a lower copay to you doesn't mean cheaper healthcare. It means higher quality care. Just like J.D. Powers ranks motor vehicle reliability, a more reliable car, you're probably going to spend less money fixing it. It kind of works the same way in medicine. What we've experienced, and this is probably the thing that is the most encouraging to us, is that employers are going from about 26% of their paid claims going to top quality in the year before they implement SimplePay.
Okay.
Last year, we ran at 86% of paid claims. And our biggest takeaway from this was, Americans are great consumers of anything, including healthcare, only when they have the information and it's simple. And they will, on their own, naturally select higher quality care.
Well, yeah, I don't doubt that that's the case at all. I'm glad there's quantifiable data to show that, right? But you kind of had to do it on faith in the first couple of years.
We did,
right?
And that's kind of Scott's biggest motivation. He was like, at Compass, I couldn't get engagement rates to be at the level I wanted them to be.
Yeah.
And we just figured out that getting rid of insurance complexity causes us to behave like we do when we buy anything else in the real world. And that's why the 86% number, I don't mind telling you, is way higher than our hopes were, for wild success. So now that we've seen that, we know what's possible. Very consistent result that applies, by the way, for blue collar, white collar, and gray collar populations.
Well, I'm curious then. So let's say we get critical mass and you've got 86%, maybe that number goes to 80 or 90, who knows the range. But then what does that do to those low cost providers' bottom line, right? Are they starting to get a noticeable drop in patients that are coming to their facilities? Then if I'm that provider that's in red, how do I change my scoring, right? I mean, I think some of those things I don't know if there's an answer for yet, but I can see the downstream impact to some of those lower quality providers that might affect their businesses, right? Or might change their behavior, hopefully, as well, right?
You're touching on an area that I'm gonna go kind of dangerously to the edge on.
I know. Okay.
So there's a nationally recognized health system, very well-known health system, and we've been working with their leadership team. They are part of a large ACO insurance program that, kind of creates those narrow networks. And meeting with their ACO, several weeks ago, I asked him the question. I go, does your system in the aggregate deliver better quality than the providers that are not a part of your system? And he admitted, he said, listen, we got providers in our ACO that are high quality, average, and not so much. And he's looking at how can we use the SimplePay model to rank providers inside of their ACO. And I think where we are today is just a realization that we don't want to be hospital haters. We don't want to point the finger to providers that maybe aren't ranking as high as the enemy. If you kind of look at what's going on in medicine, we need to be leaning in and helping those providers, giving them scorecards to show them what they can do to improve. We don't want to give up on that. Our industry, for the most part, has been focused on trying to empower the provider to perform better. What we do with SimplePay is we add to that, empowering the patient to make better decisions.
Okay.
And I think I think the tide will rise for all. As patients choose higher quality, as providers see that shift towards top quality, those that maybe could look at how they're practicing medicine in a different way, I believe that we'll see that.
I like that because it doesn't
everyone.
have to be adversarial. It just goes, hey, here's a couple steps that you could actually take to improve your quality scores, or a couple behavioral changes or billing changes or whatever those things are that are considered. It's not like it's an all or nothing and, well, you're stuck in red for the rest of your career. You have an opportunity to improve.
I'll tell you a story. I was talking with a broker. This is a great story, by the way. I was talking to a broker in Ohio a while back, and his brother is a neurosurgeon. And he said, hey, look up my brother. I'm going to see him over Thanksgiving. I want to know how he ranks. And I'm like, oh, gee, this could end up going really poorly if he's not a green provider. And he wasn't. He was a yellow provider. Okay. And what we showed was he's practicing medicine beautifully, but where he's admitting his patients has an infection rate that's 4 times higher than the hospital across the street. So, he shares this information with his brother over Thanksgiving, calls me the week after, and I'm like, oh, here it goes. We're going to get the pushback. And his brother said, I always worried that there was an issue going on, that patients weren't having great outcomes. I'm actually going to do 2 things. I'm going to start admitting my patients to the other hospital, and I'm going to start putting a little pressure on the hospital that's underperforming to make sure that they're administering an antibiotic pre-op, because that's what's driving a higher infection rate in their patients, that are being discharged. So again, I think that as we bring this forward, I think we'll see medicine improve for all.
Well, sunlight's the best disinfectant, and sometimes it's just casting light on these issues.
I'm going to steal that. That's good. That's good.
It's one of my favorite phrases. So we'll move towards the end of this here. I will be remiss if I don't ask. Is this a fully insured plan? Is this a self-funded plan? Can it be both? So
today, we offer this on a national level.
Okay.
Again, in partnership with Aetna, adjudicated on the Meritain platform. Think of CVS Health, Fortune 5 organization, real champions for wanting to see improvements in the healthcare system where everybody wins, right? Plan sponsors, providers, and most importantly, patients. So we're super encouraged about that. Like a lot of these, innovative health plans, we've started on the self-insured space. We can technically go down as low as 51 employees, and can also offer this on a level-funded chassis as well. Okay. Yeah, and I think over time you will see that this will expand into insured products, but our focus out of the gate has been to start there.
Well, I love that, man. And so may I ask you, how does this differentiate with what I know in the market might be kind of similar, a bind?
Plan? So we think of ourselves as an alternative health plan. Bind is an alternative health plan. So we kind of stole the acronym AHP away from Association Health Plan to talk about alternative models like a Bind, like a SimplePay. I might even put organizations like ELAP and reference-based pricing as alternatives to traditional insurance. And Spencer, we kind of view the world from the eyes of the more organizations that are coming to try to transform healthcare. That's good for our industry.
Yep, I would agree.
We think of them as a Simon Sinek phrase. They're a worthy rival. Our models are quite a bit different. On the surface, they look the same, but how we approach it, the things we're doing around the monthly statement, our measurements on quality, some of the other tools and support that we put in on the clinical navigation and support, we think, has some unique, differences, but clearly our model, models like Bind are bringing new plan designs to the industry that we think are going to be the next generation.
Well, see, that's what I like. Plan Side's not the only one in my organization doing RFP software. There's a couple of worthy foes, friendly competitors. I don't know if you want to call them friendly, but they're worldly adversaries. But what comes as an aggregate outcome to this is that more and more people are exposed to the idea of software being applied to the RFP, right? So we all benefit from that.
That's right.
Even if some people choose us, some people choose others.
That's right.
This is becoming a normative thing in the marketplace for RFPs. So I actually view that, and I've always said I think it's actually a good thing. So a couple things. I usually ask, well, what do you think the future of healthcare is? It's very clear you've kind of put your stamp on what you believe the future is, but what would be the evolution you think over the next few years of the SimplePay model more broadly?
I'll tell you, for almost all my years in healthcare. I've been, by the way, I'm 30 years in the industry this week. So this is actually my celebration
nice.
of 30 years in healthcare. No balloons or parties this week, but it was just kind of things where you start to reflect. For almost all those years, we've been thinking about what does the future of healthcare look, where patients are empowered, where providers are supported, and I think we're at the cusp of permanent and lasting transformation. The ability for providers to get out of billing, collection, and bad debt, to focus on practicing medicine, the ability for patients to have literally at their fingertips quality transparency that empowers them to make better decisions, with financial support to pay their out-of-pocket costs. Healthcare is the second largest category of consumer debt in the country after, college student loans, and American families are drowning. When we bring these kinds of, very major transformations into the industry, I believe we're going to look up, here in a couple of years, and see a lot of these shifts happen that I think is going to be, great for our country.
Well, I certainly hope you're right, and I'm with you on that. So, closing thoughts, Wally. Kind of leave us with you're really good with sound bites. You're really good with stories. But leave me with what are your closing thoughts for the conversation we just had today?
I will just say, having been a part of a lot of startup companies in my day, and some that had great successful exits and such. What we're doing here in transforming healthcare is by far the hardest thing we've ever been a part of. So I'll take it from where we started. I'm so blessed and fortunate to have a team of people that are passionate. They wake up every day and they're passionate about changing the world. I think we use the word people, incorrectly. I think we should be talking about the individual person. There's nothing more powerful than a person who wakes up every day and is just passionate about changing the world. We call it the parking lot test. When you get to work, and you pull into the parking lot when we used to go into the offices, pre-pandemic. Do you just dread when you're in the parking lot going into the building, or do you just want to jump out of the car and run in because you can't wait to get started? If we've got a team of people that are passionate about changing the world, regardless of their role in the organization, I'll tell you what, nothing can stop you.
Well, and I feel that what you're describing. I've been in jobs before where that you get the Sunday scaries, as they call it, where you don't want to go to. I'm fortunate to be in a position now where I genuinely, my wife gets annoyed because I'm like, I want to go. I want it to be Monday.
Give me the fist bump.
I feel blessed that that's the case, man. Yeah. I'm glad to see your passion, if for lack of a better way to wrap this up, is palpable. So thank you so much for your time.
Thank you.
Thank you for sharing the story, and it's been a pleasure to get to know you, man.
Thank you so much. I appreciate it.
Bye.